This past year has challenged each one of us in ways that we never expected. Many of us have felt alone, isolated, despair, and exhausted. Some of us have never worked so hard in familiar and unfamiliar environments. So many of us have been here all along, helping, serving, and supporting our neighbors and communities. Here at Family and Children's Service, we recognize the significant moment that has been this past year, and we have continually strived to create the connections that make our community stronger.
Given the pandemic, we quickly learned that we needed to adapt and change and make our services relevant to people in spite of the pandemic. And so we got together, we made a plan, and all of our staff really were committed to making it work.
Keep building connections with people, and with that while that connection may change and look different based on some of the technologies we've had it adapted to, that need for building that connection has not gone away.
Immediately after the March 3rd tornado and throughout the COVID-19 pandemic, the Davidson County Relative Caregiver Program and the 2Gen Aftercare Program have been working to support our families through these difficult times by providing porch drop-off activities, virtual support groups, financial and material assistance, regular check-ins, and virtual counseling and support. Maintaining connections to families and finding immediate support for families is more important than ever.
Getting through this past year has been extremely difficult for many, and as a program, we have been functioning to achieve two major goals. One is to serve our clients to help fulfill the emotional and social needs and skills by identifying and processing feelings that have significance to our development as a person, family member, and partner. The other has been to meet the needs that have arisen from the isolation, stress, and difficulty presented by COVID-19. Meeting virtually with our clients, especially the children, provides an opportunity for one-on-one focused interaction with the caring adult who listens. We ask, what can we do so that you feel heard? We adapt our sessions to meet the needs of the client, primarily addressing the specific things that we can do to help them feel heard.
The CAFE program, which stands for Confronting Adversity for Future Empowerment, serves young people ages 0 to 18 who've been impacted by family substance use. We use a strengths-based case management and counseling model to support our young people and their families, and we also work with community partners to provide families with tangible support. We're currently partnered with the Safe Baby Courts as well in Davidson County to support families as advocates in the legal system. The pandemic has created a new challenge to overcome, but it's also made the need for our program much more evident. We are currently blending telehealth and in-person work to best serve our families. We believe that families are essential and that supporting them is too. We are and continue to be dedicated to being open, flexible, and creative so we can do just that.
Hi, we're at Fall Hamilton Elementary School today, and we are getting prepared for our family literacy drive-thru that is happening tomorrow. We are so excited. We're going to be able to give families some cookies and some hot chocolate to promote family bonding and connectedness. And then we're also going to be able to hand out several books to each child, as well as some literacy activities. Our whole hope for this event is to promote family bonding, to encourage early childhood literacy and reading abilities. We are not able to do many in-person family events, so we're so thankful for our partners providing these items so that we can encourage our families in a distance way, that way they're safe and we're safe as well.
Connecting Kids to Coverage is a program funded by the Federal Center for Medicare and Medicaid Services. Our program helps children and their parents or caretakers with TennCare and Cover Kids health insurance. We serve families across the entire state of Tennessee. By helping children and their families enroll in coverage and stay covered, we ensure that they have better access to mental and physical health care when they need it. Families know that they can reach back out to our team at any time with questions about how their coverage works, letters that they've received about their health insurance, or for help submitting documents to TennCare. Since March 2020, our program has been working remotely and enrolling families through technology, which is a shift from our traditional in-person practice. In addition to assisting clients via phone, we have started using a secure video, screen sharing, and document sharing platform. These tools allow us to better serve all counties in the state from a distance and to continue to work towards the larger goal of ensuring all children in Tennessee have access to healthcare. Despite being a difficult year, we were able to help over 3,000 parents and children apply or renew their coverage in 2020.
Family Focused Solutions is a program funded by the Department of Human Services to provide support services to individuals and families enrolled in the Temporary Assistance to Needy Families program, or TANF, in Tennessee called Families First. Family Focused Solutions counselors work with clients in overcoming barriers impeding their progress towards becoming self-sufficient. In March 2020, in response to the COVID-19 pandemic, Family and Children's Services had to rapidly shift our usual mode of practice. The shift was made from providing in-person counseling sessions to telehealth means, such as phone, email, text, and virtual contacts with our clients. For the Family Focused Solutions program, this shift actually increased our ability to provide clinical case management and counseling services to Families First participants due to lack of transportation resources being one of the prominent barriers for our clients in initiating and maintaining their normal counseling sessions. This was particularly true in rural counties where there is no mass transit system available. This shift in service provision, coupled with an increase in financial need for families during the pandemic, Family and Children's Services has been able to serve more families in the Family Focused Solutions program than prior to the pandemic. This learning will shape our practice moving forward. Family and Children's Service will continue to use technology to eliminate barriers such as transportation, location, or time constraints, and increase access to counseling programs across the agency.
Family and Children's Services operates a crisis contact center that offers crisis support services for individuals and families struggling with a broad spectrum of needs. The crisis line provides emotional support via phone and text to anyone, adults and teens, that may be struggling with those broad spectrum of needs, such as thoughts of suicide, grief, depression, anxiety, mental health illnesses, and etc. The phone line is available 24 hours a day, 7 days a week, 365 days a year. Prior to the pandemic, our call center already had the capability of working remotely. So when the pandemic began, we simply shifted to full remote operations, so that way the Crisis Contact Center is true to their slogan, which is any person, any problem, at any time. And you might expect in these difficult times, our call volume significantly has increased, and it remains steady throughout the pandemic so far. Because of the impact of the COVID-19, over the past year, our trained crisis specialists have taken calls from individuals that have reported they had not ever experienced symptoms of stress, anxiety, or fear prior to the pandemic. Our crisis line has also helped individuals find resources when faced with situations such as domestic violence, substance abuse, suicidal thoughts, gambling addictions that may have increased during the pandemic.